Conclusion 167. A person's disability or health condition should not determine their opportunities in life. 168. The actions set out in this white paper will improve support to enable disabled people to live more independently, including through better access to the labour market to start, stay and succeed in work. This will help increase financial resilience and ensure opportunity and prosperity for everyone. 169. We made our case for transforming the health and disability benefits system in the Health and Disability Green Paper, published in July 2021. More than 4,500 people and organisations responded to our consultation, giving us their views on our proposals. We have carefully considered these responses, and this white paper has set out our plans for change. We will transform the benefit system by removing the work capability assessment. This will ensure that those who are able to can progress in or towards work without the worry of being reassessed and losing their benefits. The system will focus on what people can do rather than the limitations of a disability or health condition. We will improve employment support for disabled people and people with health conditions, investing to help people start, stay and succeed in work, and we will improve the overall experience of the benefit system for disabled people, making it easier for people to access the right support and improving trust and transparency in our decisions and processes. 170. The improvements we have set out will help to reduce barriers to employment, support disabled people and people with health conditions to live independent lives, and ensure that they are treated with respect when they access the support they need. But there is still work to do. 171. That is why the Prime Minister has asked the Secretary of State for Work and Pensions to look in detail at the issue of workforce participation across society. Disabled people and people with health conditions are a key focus of this work, which will build on the government's existing package of support to help disabled people and people with health conditions to start, stay and succeed in work. 172. This white paper is the result of what we have heard in responses to the Green Paper and in our consultation events about what needs to change in the health and disability benefit system. But this is not the end of the conversation. We will continue to listen to and to work closely with disabled people, people with health conditions, and many other partners on how to deliver these improvements and reach our important shared goals. 173. We will develop a new Disability Action Plan in 2023, which will set out the practical action we will take across government beyond the health and disability benefit system to improve disabled people's lives. Ensuring the voices of disabled people are properly heard is a priority for this government. We will run a full public consultation on the plan later this year. That is the end of conclusion. Annexes. Annex A. How we consulted. On 25th of June 2019, we announced that we would be launching a Green Paper to explore ways to improve support for disabled people and people with health conditions. We organised 7 face-to-face events across Great Britain and over 30 virtual events following the outbreak of the COVID-19 pandemic in March 2020 to ensure that the views of disabled people and their representatives shaped the content of the Green Paper. We published the Green Paper, which we titled Shaping Future Support, on 20th of July 2021. We offered a number of alternative formats, including an audio summary, full audio, online and on CD, a British Sign Language version, and hard copies of the full publication, easy-read versions, Braille and large print. To learn what people thought of our proposals, we asked questions about our plans. We gave people 12 weeks from publication day to let us know what they thought. The consultation ended on 11th of October 2021. During this consultation period, we held a series of over 40 consultation events to hear directly from people and have an open discussion about the Green Paper. This included 11 face-to-face events, one in every region of England, one in Scotland and one in Wales, in a mixture of urban locations and smaller towns in rural areas. This meant we involved people from across Great Britain and from different places to make sure we were hearing a variety of views. So that the discussion at these events went into depth on the Green Paper proposals, each event focused on a specific part of the Green Paper: rethinking assessments, improving employment support, or improving the structure of the benefit system. However, each event included an opening section for attendees to share their experiences of our services and to raise any issues they wanted to. To make sure that we were also involving people who did not want to travel and attend face-to-face events, we offered people the choice of attending an alternative virtual event on the same topic. We held 6 of these public virtual events in all. We publicised the events through disabled people's organisations, local and national charities, on social media, and through our stakeholder magazine. The events were attended by a mixture of disabled people and people with health conditions, carers and representatives, many from smaller local disabled people's organisations. We also organised 18 events with charities and organisations who arranged for their users and staff to attend and share their views on the Green Paper. Charities and organisations chose which part of the Green Paper they wanted the event to focus on and whether they wanted to hold the event face-to-face or virtually. We are grateful to the following for their help in organising these events: Adult Cerebral Palsy Hub, Ambitious About Autism, Royal British Legion, Down Syndrome Association, Disability Rights UK Disabled Apprentice Network, Expert Link, Headway, Macmillan, 2 events, Marie Curie, Mind, Multiple Sclerosis Society, National Network of Parent-Carer Forums, Royal National Institute of Blind People, 2 events, Scope, Sense, Youth Employment Group. During the consultation, we established our Ethnic Minorities Forum. This let us hear the views of people from ethnic minority backgrounds who have personal experience of the health and disability benefit system. We held the first event with the forum during the consultation period so members could share their thoughts on the Green Paper. We held Green Paper events with our existing forums, the General Practitioner Forum, the Operational Stakeholder Engagement Forum, and the Health and Disability Policy Forum. We also held 5 events with the regional stakeholder networks. We met with the Disability Benefits Consortium, a national coalition of over 100 different charities and organisations, and held an event with a group of charities on improving the appeal lapsing process. We held 2 events with DWP staff in a variety of frontline roles to learn from their experiences delivering our services. We also met with the Federation of Small Businesses and the British Chambers of Commerce to discuss the Green Paper's proposals on improving employment support. To make sure as many people as possible could contribute in writing, we set up a consultation survey using the online platform Citizen Space. We received more than 4,500 responses, with roughly half of those coming via Citizen Space and the other half via email. Almost everyone who responded via email did so as part of a concerted campaign arranged by an organisation. We thank all organisations that ran consultation events, online surveys or focus groups to gather the views of a wide range of people and for their own responses to the consultation. More than 90% of those who responded via Citizen Space reported a disability or health condition lasting more than 12 months. After the consultation closed in October 2021, we read every written response and grouped them into common themes and experiences. We have carefully considered the feedback we have received to our consultation in developing the next steps set out in this white paper. There is an outline map of the UK accompanying this annex. The map is marked with red dots showing the sites of events in Leicester, Newcastle, Shrewsbury, Norwich, Wrexham, Canterbury, Bournemouth, Leeds, Glasgow, London and Bolton. Annex B. Across the UK. The UK Government is committed to improving the lives of disabled people and people with health conditions across the whole of the UK. The Green Paper consultation welcomed views from people across the United Kingdom. This section sets out the extent to which these reforms will apply in each part of the UK. The Minister of State for Disabled People, Health and Work in the UK Government has cross-government responsibility for disabled people across the United Kingdom. In Northern Ireland, responsibility for policies on employment support and social security sits with the Northern Ireland Executive. In Scotland, some parts of the social security system remain the responsibility of the UK Government, and others are devolved. The latter includes PIP and DLA. These have been replaced by new Scottish Government benefits for claimants newly claiming benefits. The proposals in this white paper will therefore not apply to Scottish benefits. The changes proposed for ESA and UC will apply in Scotland, since these benefits will remain the responsibility of the UK Government. The DWP will work with the Scottish Government to consider the implications of our proposals for claimants in Scotland. There are two footnotes to this paragraph. The first reads, "The responsibility for additional needs disability benefits, including PIP and DLA, and for weekly paid industrial injuries benefits, transferred to the Scottish Government in April 2020. The responsibility for carers allowance transferred in September 2018. The second footnote reads, "Child disability payment replaced DLA for children in 2021 with adult disability payment replacing PIP in 2022. The annex then continues. Currently, DWP continues to deliver PIP and DLA on behalf of the Scottish Government under agency agreements on the same basis as in England and Wales. This will continue until all existing claimants have been transferred to the new Scottish benefits. We will work with the Scottish Government to ensure that the proposals in this paper are applied to PIP and DLA in Scotland, whilst agency agreements are in place. This includes the changes to the special rules for end-of-life in PIP, DLA and attendance allowance, which are outlined in Chapter 3 of this white paper. The changes that have already been made in ESA and UC apply in Scotland, since these benefits remain the responsibility of the UK Government. The Scottish Government is already delivering child disability payment, its replacement for DLA for children, and started to deliver adult disability payment, its replacement for PIP, from 29th of August 2022. With respect to employment support, the Scottish Government has concurrent powers to set up programmes to help disabled people into work. It has similar powers to support people who are claiming reserved benefits and at risk of long-term unemployment, provided this support lasts for 12 months or longer. The UK Government remains responsible for the support provided by Job Centre Plus and for other contracted employment support in Scotland. The proposals in this white paper apply in Scotland to areas that are reserved to the UK Government. In Wales, employment support and social security are the responsibility of the UK Government, save for certain functions relating to employment support which may be exercisable jointly or concurrently with Welsh ministers in some circumstances. The proposals in this white paper relating to those areas that are the responsibility of the UK Government apply in Wales and include PIP and DLA. The Scottish and Welsh governments are responsible for health, local government, education, skills and social care. Where the proposals set out in this white paper relate to these areas, they focus on what this means for England. We remain committed to working with the Scottish and Welsh governments and with the Northern Ireland Executive to consider how best to deliver support for disabled people and people with health conditions. That brings us to the end of this audio presentation of Department for Work and Pensions Transforming Support, the Health and Disability White Paper. Department for Work and Pensions, www.gov.uk. ISBN 978-5286-3687-2, E027986110.